Okay, hello everybody, and today we have a webinar on CQC compliance. Now, this is an area that we know many dental practices have issues with, have concerns about. So we're lucky enough in our team to have Jody in our team, who's got a lot of experience in dealing with the CQC. And so you're going to give your top tips for CQC compliance, Jody. Hi, Jody. How are you doing? All right?
Yeah, I'm good, thank you. How are you?
Yeah, I'm good. I'm good, thanks. So take it away, Jody.
Lovely. Okie doke. So yeah, we'll be talking about compliance today, the implementation of it and maintenance, and a few sort of top tips just to help practices out there. And I know it's not an area that people enjoy most, but hopefully we can kind of give some advice and information just to make it a bit more sort of easier to manage. Okay, so
Check. The slides are working, Jody. What can you see?
so I can see your screen, and then will you be...
I'll move them along for you, so yeah, no worries.
Lovely.
So go for it.
Lovely. Okie doke. So just a little bit about myself to begin with. So for Samera, I'm the client relations manager. I've got over 10 years experience in dentistry, so I've worked in both the NHS and the private sectors. I've done some practice management, and my role prior to this was a CQC compliance consultant, and that's where I've sort of picked up all of my knowledge based on that. And now I help dentists alongside Aaron set up their practices, and compliance does come into that as well.
Cool. So starting up, where do we go to?
Yeah.
There's so much to cover, isn't there? And compliance
there is definitely. So depending on whether, I mean, it doesn't really matter if you are an existing practice and you've had compliance set up for a number of years already, or if you're a brand new practice as well. My advice would always be just to get some help, get some advice. Don't be scared, don't be afraid to ask for that help. You can always, even if you have had compliance set up in your practice for years before, you can always start up afresh, use up the information that you've got previously just to get sort of a more updated system in place. So first advice, get some help from somebody. This could be a compliance company. It could be a staff member who is experienced in compliance as well. So that's definitely a good place to start. So somebody who's experienced, who's dealt with compliance before, even maybe somebody who has actually gone through an actual real life inspection in their practice, because they'll know what the inspectors look for. So this person hopefully will be able to help you set up your compliance and implement it in your practice as well. Should be somebody who's aware of the documents and the policies that you need, how to sort of personalize those documents, how to review them as well, and what documents you need. Another huge area which we'll touch on shortly in more detail is your staffing file requirements. So your HR files, that's a huge area, something that CQC are very hot on and they look into. So you need to make sure that you're aware of what's needed. Servicing and maintenance, so all of your equipment in your practice as well. How often do you need to have those serviced? And just general sort of maintenance and the requirements of that. And also another important factor is making sure that you're aware, or the person who's looking after compliance knows about sort of any updates with the latest legislation as well. Okay, so setting up your compliance to begin with then. So there's a few different folders, quite a few different folders that you may need. You can have this set up as an actual folder hard copy setup, or you can do this electronically on your computer as well. So some of the policies, some of the folders that you'll be looking at. So you've got your main policy folder, complaints and significant events. So this folder, really important, every practice needs one. Any complaints that you have, if you have them, you need to make sure that they're all sort of logged in a folder. You can demonstrate that you've done your sort of 3 days acknowledgement letter, and then your 10 or 14 days in responding to the complaints, and just have that all organized in a folder so you know sort of the steps that you've taken. With significant events as well, so anything that happens in your practice, an incident, a significant event, it could range from a trip or a fall, it could be a medical emergency, that all needs to be logged. Now, the reason for that is one, just logging what happened, who was involved, what happened, what you actually did to overcome that issue or that incident. And the main focus on this is how will you work to prevent something like that happening again? And that's what CQC will look for. You know, something's happened, what have you done to make sure that doesn't happen again? Have your team learned in your practice? Of course, then you've got your general audits and risk assessments folder, which we'll go through shortly as well. Your staff folders, practice meetings, COSHH folder, GDPR. And then on the next slide, we've got some more folders as well that you will need to have in place. So of course, your fire folder, this is a really important one. So you need to make sure that you're doing your weekly fire checks. Are you testing your equipment, your extinguishers? If you have a fire alarm system, are you testing that over weekly as well? So all of that would go into that folder. Your radiation protection folder. Now this is something, so you would usually be signed up to an RPA, to a radiation company. So you need to have an advisor that you are signed up to, and they would help you with everything radiation in your practice. They will be that go-to person for advice if you are not sure on anything. They can help you set up your local rules. So all of that information would be going into your RAD folder. And then of course you've got your practice logs and checklists, service and maintenance folders, MHRA folder. This is one that I found that a lot of practices don't think about or have set up in their practice, and this is really important. So for those of you that may not know, MHRA, that's your medical alerts system. So you should be signed up to receive any alerts for any medication, any equipment from the authorities. If there's any issues, you'll be alerted via email to let you know that there's been a recall for this particular medication, or there's been a fault with a certain particular type of equipment. It could be a defib, for example. You've got to make sure that, one, you are subscribed to receive those emails and alerts, and two, you are actually then sort of going through and having a look if you've got that equipment or that medication in your practice. What you've then got to do, if you do have that equipment or medication, is action that report. It will tell you in that alert what you've got to do, how you've got to dispose of it, and any other information that you need as well. So really important to make sure you're signed up to that. Print off that document that you get, just scribble on there what you did, the date that you sort of disposed of that equipment, how you replaced it. And then again, the most important thing is sharing that with your team. So have you informed your team that there's been this alert? Have you told them what you've done? Have you made them aware of sort of, let's say, batch numbers of that particular equipment, so they can keep an eye out in practice if there is anything else as well? And again, documenting that, keeping that all into that folder. If the alert isn't applicable to your practice, you can sort of just ignore that. You can move that email into a separate folder, or you can print it off as well and just put not applicable to our practice. Okay, so really important to make sure you have that folder. That is one that's commonly missed. Your general surgery and decom folders, and again, COSHH folder, and then your waste folder as well. So waste folder, this is where you will keep your contracts with your waste providers. This is where you will log all of your consignment notes. So every time your waste is collected, the driver will give you a consignment note. A staff member's got to sign that. It will just tell you details about what was collected, how many bags, the date, and you've got to keep that as evidence. So all that will go into your waste folder as well. Okay, so just a little bit about the policies and procedures folder. So it's quite a boring folder really, and it becomes quite a big one with lots of policies. So one, just make sure the policies are actually organised within regulations. So again, going to a lot of practices, I found that the policy folder is actually still organised in outcomes, and that was the old way in which policies were organised. They actually need to be organised within regulations now, so it falls within regulation 7 to 20A. If you have a look on the CQC website, this will all be detailed on there. It will tell you what regulations you need in a dental practice. Regulations of 1 to 6. Got somebody joining?
That's the reality of
Yeah.
not getting excited about policies and procedures in
Exactly.
a webinar. So that wasn't meant to happen, but anyway.
It's fine. So regulation 7 to 20A, that is what dental practices must follow. Anything before and after that would sort of relate to GP practices or care homes. So that doesn't apply to us. So you've got to make sure you have the correct policies within each regulation. So for example, regulation 20, that is called dignity and respect. And the policies, there's just 3 policies that you need, mandatory policies that are needed within that regulation. So you can see them there. You've got equal opportunities policy, your equality, diversity and human rights policy, and you've got your privacy and dignity policy as well. So again, they've all got to be up to date with the recent legislation. Policies don't really change that often, to be honest with you. Which is a good thing, because it is very time consuming sort of updating these documents. When and if they do change or there is an update, again, somebody who is a compliance officer or your compliance company that you work with, they will be able to give you those updates and maybe even sort of send you the updated document as well. But again, if you haven't got anybody helping you, again, just go onto the CQC website and all that information will be on there. And then generally with your policies folder, once you've got that all up, organised, you've got to make sure that all of your team are aware of the policies, they have access to them, they have read them, they've signed them to say that they understand them. And then on a yearly basis, I would say just to review the documents, make sure that there haven't been any changes, make any updates that you need to, and then you can have sort of a front signing sheet at your policy folder to say that once a year we've reviewed this policy, no changes, or these are the changes, and just sign that off. Okay. Your audits and your risk assessments, I've kind of broken down here what audits, what mandatory audits are needed, and your risk assessments as well that are quite frequently done. So a lot of practices are doing so many audits that are not actually mandatory. Now, there's nothing wrong in doing all of these audits and risk assessments, but again, it's time consuming. So you want to just make sure that you are complying with what's mandatory and essential. So the audits that you must do, and the ones that are 6 monthly, are your radiograph audits, your clinical record keeping, and your infection control. Now, again, your templates for these, your RAD and your clinical record keeping, you can get them from your compliance company. The infection control audit, this is actually available on the IPS website. So they've got the whole audit available on there. You can complete it online as a toolkit, which is available, or you can print out the document as well. And then the 3 that are sort of ones that you would need to do once a year, your antibiotic prescribing audit. Now, this is one that's not been around for many, many years, but I'd say the last sort of 2 to 3 years, CQC have been looking for practices to complete the antibiotic prescribing audit. And that's just to make sure that the dentists in your practice are prescribing correctly, they're not over prescribing, and when they are, that they're putting all the correct information on there. Your DDA audit, so disability and discrimination, this is one you've got to do when you open up your practice, when you set up your practice, and this will highlight where you are and where you may not be accommodating for patients who have a disability. So it will go through things like, do you have wheelchair access into your practice? If you don't, what can you do to sort of accommodate for that, i.e. a portable ramp? Do you have anything for patients who might be hard of hearing? So that could be a hearing loop. And what you've got to do is just go through the set of questions. If you haven't got that, or some of the items, just put a plan of action in place, factor it into your yearly budget, and sort of say that, you know, in the next 6 months, we'll be looking to purchase a hearing loop. Because again, you can't sort of, it's quite difficult financially as well to equip your practice with everything in one go. So these audits will help you plan out what you need to put in place, how to put them in place, and financially sort of prepare for that as well. Patient satisfaction surveys. So again, these are sort of reviewed, I'd say annually, but you can pretty much do these however often you want, really. So if you're an NHS practice, the NHS require you to complete the FFT, so friends and family testing sheet. So this is something you would have in your waiting room. You would just ask patients, would you mind completing one of these surveys? And every month you've got to submit them to the NHS. If you're a private practice, it's up to you really how many of these you get completed and how often you review them. But I'd say annually is good. You can sort of collect a good number over the year and review them just to see, what are patients suggesting? Do you need to make any improvements in your practice? And that's how you're going to get better in your practice as well. Okay. And your risk assessment. So the two sort of main ones, or the two external ones that you'd be looking to have done, would be your fire risk assessment and your Legionella. Now, these are usually completed every 2 years. It's not necessary that you need to have an external person come out every 2 years, because you might be low risk for both of them. So what I would say is assess the report and have a look at any actions or recommendations. Make sure you sort of go through those. And then you can do an in-house risk assessment yourself every year. And then, of course, you've got sort of your other annual risk assessments, like your SHARPS risk assessment, your health and safety, and your staffing ones as well. Health and safety then, and COSHH, again, a very big folder, so prepare yourselves for this one if you're putting this together. One good thing though, when you have put it together, that is pretty much all the work done. Again, a lot of practices with this, they don't understand how they've got to put this folder together and what it needs to include. So what you've got to do is, with all of your hazardous products in your practice, you have to have a data safety sheet for each of those, and that you can get from your stock provider. They will have a whole bank of these documents. And what you've then got to do is, if any product has a hazardous sign, you've got to do a COSHH assessment on each of those products. So put it with your data safety sheet. The sheet will give you the information you need to complete your assessment. Go through sort of, the storage of that equipment, what you would need to do if, let's say, etch got into somebody's eyes, how you would manage that. Once you've got those assessments together, that's done then. The only reason that you would need to sort of change or amend anything is if you've ordered a new product. If you're not using that product anymore, you can then just archive that document. And what you can then do on a yearly basis is just review the COSHH folder. Have you had any new products? Do I need to update anything? And that's just a yearly ongoing thing. So with the COSHH folder, I would say definitely get a staff member to help you, or 2 staff members. It does take some time to put together initially. And also, one thing to consider is having a space in your practice where you can actually store some of these COSHH products. So they may need to be locked away somewhere under lock and key. But again, you'll get all of that information from your data safety sheet as well. Surgery and Decombook. So again, you've got to make sure that you're logging and documenting when you set up your practice, set up your surgery in the morning, when you close down of an evening as well. And also for your decontamination room, the same thing. What have you done to set up? What have you done to close down? Have you done all of your checks that need to be done? So your TST strips for your autoclaves, the type of autoclave that you have you got a vacuum one or a non-vacuum? It depends then what type of validation test you have to do. And all of this needs to be logged and stored. And a lot of practices ask, how far back do we need to keep this information? We say 2 to 3 years is sufficient. Anything before that you can either archive and keep, or you can get rid of that as well. And again, same with your folders. You can have this stored electronically, or you can do this in an actual hard copy folder as well. Okay, your servicing and maintenance folder. So you've got to make sure you're up to date with all of your annual or biannual services. So the easiest way to do this, and I can't stress this enough, is just have some sort of calendar system where you are putting in the dates that you've had that equipment serviced, and then just have a reminder system set up. So if you're with a compliance company, they may have a portal, they may have something where this is all set up for you and it sends you automatic reminders. If you don't, not to worry, just use a Google Calendar, your phone, anything like that, just to remind you, because a year or 2 years just goes by so quickly, and before you know it, you've got to get your autoclave serviced again, and you don't want that to go over the time. So yeah, making sure you're aware of the frequencies, and making sure that you know when you need to get these serviced. So PAT testing, for example, the companies who do PAT testing will tell you that it needs to be done every 3 years. But actually there's no set requirement. If you have a look on the CQC website, it's advised to sort of have it done every 2 to 3 years, depending on if you've had sort of new equipment. And being aware of frequencies as well, it can also help you save money in the long term as well. So rather than having something done every year, you can stretch that out to every 2 or 3 years. So with that calendar setup and knowing the frequencies, again, that's going to help you sort of be aware, and your team be aware as well, whoever's helping you with compliance, how often things need to be done. So just as sort of a general, so daily sort of checks, you'd be looking to do your fridge temperature checks. Now, if you have any products, materials that are stored in a fridge, you do then have to have a thermometer in the fridge, and you do need to check the temperature of that daily. So it's a quick sort of open the fridge, have a look at the temperature, make sure it's within the 2 to 8 degrees. Once you've checked that, just sign off the sheet. Of course, you've then got sort of your visual oxygen cylinder checks that you can do. Of a weekly, you again need to do your surgery and decon checks, your fire checks, really important as well. This is something a lot of practices do miss. I would recommend just to do those checks of a Monday morning, the same with your medical emergency kit as well, just so you know everything's in order, working correctly for the start of the week. Your monthly tasks, so practice meetings, CQC recommend that you do meetings every 4 to 6 weeks. It's really important just to have that sit down with your team, so you're all sort of on the same page, you know of any updates or anything that's happening in your practice. With COVID as well, of course, you haven't been able to have sit down meetings in your practice. Teams meetings are absolutely fine, but just document those, even if you've had a WhatsApp call, video call, even if a manager or principal has sent out an email, just log that as part of your sort of meetings. Your water temperature checks need to be done every month as well, making sure that you're within the range, that the water temperature doesn't go below 20 or above 50. 6 monthly, so those would be your audits. Annually, you'll be looking at your servicing, your risk assessments, checking your COSHH folder, and then 2 yearly, 5 yearly. So again, depending on the risk assessments that are due, and fixed wire testing, that would be every 5 years in your practice as well. Okay, so I mentioned before that your staff HR files are a huge part of compliance. So it's crucial that every staff member in your practice, and this is also including your self-employed staff members as well, so the principal, the dentist, the hygienist, everybody needs to have a HR file. CQC are very hot on this. They expect you to have a robust recruitment system in place. They need to make sure that you've got all of the documents that you need. We'll go through what's needed on the next slide. Another thing to mention as well, oops, sorry, just going back there once. As of April next year, so it will be mandatory for all healthcare staff members to have had their 2 COVID vaccines. That's if you're NHS or private. A lot of dentists are retiring because they don't want to have the vaccine. So that's something to make sure that you are looking at through your staff files next year as well. DBS checks, huge grey area with this. There's no actual set requirement of how often a DBS needs to be redone. CQC and on the website, it's recommended for a DBS to be redone every 3 years for clinicians and hygienist therapists, and every 5 years for every other staff member. One sort of easy way to maintain this is for everybody to go into the annual update DBS system. So you would need to have a DBS done at least once. You've then got 28 days to apply for the update system. It costs £13, and it's then a yearly rolling on £13 system. And what it does is just does your DBS every year, does any checks, and that's sort of a good way to keep up to date with DBS checks as well. You can do an in-house DBS risk assessment. So if you're not getting DBSs done every year or every 2 or 3 years, 2 or 5 years, sorry, just do an in-house risk assessment once a year. So as we mentioned, so these are the things that we'll be looking to have in your staff checklist. So your staff details, really important to have an emergency contacts, 2 forms of ID, references. So when you are interviewing somebody, before you offer them the position, just ask them for 2 references, get those references back. It will help you make your decision. They go in the file as well. Hep B status. A lot of people actually miss the titer levels on your Hep B vaccination. So they show us proof of the 3 vaccinations, but then they haven't shown us if they're actually immune or not. So you need to have that. Of course, you've got your GDC certificates, indemnities, and CPD as well. Yeah.
And some tips from you, Jody.
Some tips, yeah. So top tip with compliance, don't try sort of tackle it on your own if you don't know anything about it. Get some advice from a compliance company or an experienced compliance person. Delegate, delegate, delegate. Spread out the tasks between your team. Get them all responsible for doing something. It will make your life easier. Work folder by folder. It's a huge sort of task anyway. So just set yourself that target of, okay, this month I'm going to get the policies done. This month I'm going to put the complaints folder together. Know what's needed as well. That's really important. So you're not doing anything less or more. Set up the calendar system to remind you when things are due. Check the CQC website. Everything you need is on there. And again, don't be afraid to ask for help. If anybody has any questions, then feel free to get in touch. That's my email address, my contact number. And you can also go onto our Samera website as well. You can arrange a video call with me on our Calendly link. All of our details are on there. So yeah, any questions, feel free to get in touch. And hopefully that's sort of given everybody a bit of advice and information on compliance.
Brilliant. Josie, thank you. It's quite a lot to cover in a short space of time. Okay, and it's quite heavy going, but I think you managed to get the gist of it across to everybody in this webinar. So thank you. Okay. No, and as Josie mentioned, if you need any help, just drop her an email, get in touch with us, and she can certainly point you in the right direction and hopefully help you. Okay. So thanks again, Josie, and yeah, we will be in touch with the next webinar very soon. Thanks very much.
No problem. Bye, everyone.